Did you know that certain fruits marketed as superfoods could be accelerating kidney damage in millions of people right now? While conventional wisdom tells us fruit equals health, emerging research reveals a more complex reality. For individuals with elevated creatinine levels or compromised kidney function, specific fruits can trigger a cascade of mineral imbalances that silently strain already vulnerable filtration systems. The mechanism is straightforward, yet overlooked. When kidney function declines, the body's ability to excrete minerals like potassium and phosphorus diminishes significantly. This creates a dangerous accumulation scenario where foods considered nutritious become metabolic liabilities. What makes this particularly concerning is the absence of immediate symptoms. You won't feel potassium building in your bloodstream until concentrations reach critically dangerous levels, potentially triggering cardiac arrhythmias. Today, we're examining 4 fruits that pose genuine risks for compromised kidneys, and 3 that scientific evidence suggests may actually support kidney health. These aren't arbitrary recommendations. They're based on peer-reviewed research, tracking thousands of patients over multiple years. The prevalence of this issue extends far beyond what most people realize. According to the National Kidney Foundation, approximately 37 million American adults have chronic kidney disease, yet roughly 90% remain unaware of their condition until significant damage has occurred. This knowledge gap creates a perfect storm where individuals consume foods they believe are healthful while unknowingly accelerating their decline. The conventional medical model focuses predominantly on pharmaceutical interventions and monitoring laboratory values, leaving nutritional guidance as an afterthought, often introduced only when disease reaches advanced stages. This approach misses a critical window where dietary modifications could substantially alter disease trajectory. Consider the standard patient experience. Mildly elevated creatinine triggers a prescription, perhaps advice to reduce sodium, but rarely comprehensive guidance on mineral management through food selection. Patients continue their routines, including daily consumption of high-potassium fruits, while their kidney function gradually deteriorates. The laboratory numbers worsen, medication regimens expand, and eventually dialysis becomes inevitable. What's particularly tragic is that research published in major nephrology journals demonstrates that strategic dietary modifications, particularly regarding fruit selection, can slow progression rates by up to 30% in early to moderate stage kidney disease. Yet this intervention remains systematically underutilized. The gap between available evidence and clinical practice leaves millions of patients without access to information that could meaningfully extend their kidney function. Your kidneys respond not only to medications, but to every nutrient that enters your bloodstream. When we examine the foods that either support or undermine kidney health, fruit emerges as a category requiring particularly careful navigation. Number 4, bananas. The banana represents perhaps the most deceptive threat to compromised kidneys precisely because of its wholesome reputation. Athletic recovery, heart health, natural energy. These associations dominate public perception. However, for individuals with reduced glomerular filtration rates, bananas present a potassium concentration that can rapidly push blood levels into dangerous territory. A single medium banana contains approximately 420 milligrams of potassium. To contextualize this number, patients with stage 3 or 4 chronic kidney disease are typically advised to limit total daily potassium intake to 2,000, 3,000 milligrams. One banana consumes roughly 15–20% of that daily allowance in a single serving. The physiological consequences unfold gradually but inexorably. As potassium accumulates in the bloodstream, a condition termed hyperkalemia, it begins interfering with electrical signaling in cardiac and skeletal muscle. Early symptoms include generalized weakness and numbness, easily dismissed or attributed to other causes. However, as concentrations rise above 6.0 millimoles per liter, cardiac conduction abnormalities emerge. Studies published in the Journal of the American Society of Nephrology document that severe hyperkalemia can trigger ventricular fibrillation and sudden cardiac arrest, complications that may prove fatal within hours if untreated. What amplifies this danger is the cumulative effect. Patients rarely consume just one high-potassium food daily. When bananas combine with orange juice at breakfast, a serving of tomato-based pasta sauce at lunch, and potatoes at dinner, total potassium intake can easily exceed 4,000 milligrams, doubling recommended limits. The kidneys, already operating at diminished capacity, cannot eliminate this excess efficiently. Research from the Cleveland Clinic, following 1 in 200 patients with chronic kidney disease over 5 years, found that those who regularly consumed high-potassium fruits experienced progression to end-stage renal disease, an average of 18 months earlier than those who modified their fruit intake. These aren't marginal differences, they represent years of independence and quality of life. Bananas also appear in numerous processed foods, often disguised. Smoothie blends, protein bars, baby foods, and even some medications use banana as a binding agent or flavoring, creating hidden sources that further compound the problem. Number 3, citrus fruits. Oranges, grapefruits, and other citrus varieties carry a dual burden for struggling kidneys. High potassium content combined with significant acidity that can exacerbate metabolic complications. A medium orange delivers approximately 240 milligrams of potassium, while a cup of orange juice can contain upward of 450 milligrams. The juice concentration is particularly problematic because it eliminates fiber, the natural component that slows sugar absorption and provides digestive benefits. Without fiber, you're essentially consuming a potassium and sugar concentrate that rapidly enters the bloodstream. Grapefruit introduces an additional complication beyond mineral content. It contains compounds called furanocoumarins that significantly interfere with cytochrome P450 enzymes in the liver. These enzymes metabolize numerous medications commonly prescribed to kidney patients, including certain blood pressure medications, statins, and immunosuppressants. When grapefruit inhibits these enzymes, medication concentrations in the blood can rise to toxic levels, creating dangerous side effects. The FDA has documented over 85 medications with clinically significant grapefruit interactions, many of which are standard prescriptions in kidney disease management. Research conducted at the University of Florida tracked 650 patients with moderate chronic kidney disease who consumed citrus fruits daily. Over a 3-year period, this group experienced a 22% faster decline in estimated glomerular filtration rate compared to patients who limited citrus intake. The study, published in the Clinical Journal of the American Society of Nephrology in 2021, suggested that the combination of potassium load and acid burden created compounding stress on already compromised nephrons. The acidic nature of citrus also contributes to metabolic acidosis, a condition where the blood becomes too acidic. Healthy kidneys maintain acid-base balance by excreting hydrogen ions and reabsorbing bicarbonate. When kidney function declines, this regulatory mechanism fails, and dietary acid sources like citrus can tip the balance further. Metabolic acidosis itself accelerates kidney disease progression by promoting protein catabolism and bone mineral loss. You'll find citrus in unexpected places. Salad dressings, marinades, flavored waters, and even some vitamin supplements use citrus extracts or citric acid, adding to your daily potassium burden without obvious awareness. Number 2, melons and tropical fruits. Cantaloupe, honeydew, mangoes, and papayas deliver substantial potassium loads wrapped in natural sweetness that makes overconsumption easy. A single cup of cantaloupe contains approximately 430 milligrams of potassium, while a cup of mango provides around 325 milligrams. These fruits often appear in large serving sizes, particularly in fruit salads, smoothie bowls, or as snacks, where portion control becomes challenging. The psychological aspect matters here. These fruits taste refreshing and light, creating a perception that you can eat larger quantities without consequence. However, for compromised kidneys, quantity directly correlates with risk. Tropical fruits also tend to carry higher natural sugar content. While fructose from whole fruit includes fiber that moderates absorption, the total sugar load still matters for kidney patients, particularly those with concurrent diabetes. Research published in the American Journal of Kidney Diseases in 2022 examined 3,400 patients with diabetic nephropathy and found that those consuming high-sugar fruits more than 3 times weekly experienced faster progression to advanced disease stages. The mechanism involves glycation, where excess sugar molecules bind to proteins and form advanced glycation end products. These compounds accumulate in kidney tissues, promoting inflammation and fibrosis that gradually destroys functional nephrons. Watermelon, despite being 92% water, concentrates approximately 170 milligrams of potassium per cup. While lower than cantaloupe, the typical serving size of watermelon often exceeds 2 cups, quickly elevating potassium intake. Summer gatherings and picnics where watermelon features prominently can inadvertently create acute potassium spikes in vulnerable individuals. A case study from Johns Hopkins documented a 68-year-old man with stage 3 chronic kidney disease who developed severe hyperkalemia, requiring emergency treatment after consuming nearly half a watermelon at a family barbecue. His potassium level reached 7.2 millimoles per liter, well into the dangerous range. These fruits also appear in dried and dehydrated forms, where water removal concentrates both sugars and minerals into compact servings. Dried mango, papaya chips, and fruit leather can deliver several servings worth of potassium and sugar in just a few bites, creating concentrated exposure that bypasses normal satiety signals. Number 1, dried fruits and fruit juices. These processed forms represent the most hazardous fruit category for kidney patients because they concentrate all the problematic elements: potassium, sugar, and often added preservatives, while eliminating the protective fiber and water content. A quarter cup of raisins contains approximately 270 milligrams of potassium, yet provides minimal satiation, making it easy to consume double or triple that amount. Dried apricots deliver roughly 380 milligrams per quarter cup, and dates contain around 280 milligrams in just 2 fruits. The dehydration process that creates these products removes water while leaving minerals intact, effectively condensing multiple servings into small volumes. This concentration effect creates a particularly insidious problem: portion distortion. When you eat 3 dried apricots, you're consuming the potassium equivalent of 3 fresh apricots. But the physical volume and psychological satisfaction suggest you've eaten far less. This easily leads to overconsumption without conscious awareness. Research from the National Institutes of Health, tracking 5,200 adults with chronic kidney disease, found that regular consumers of dried fruits and juices had 40% higher rates of hospitalization for hyperkalemia compared to those who avoided these products. Fruit juice compounds these issues further by removing fiber entirely while concentrating sugars. A single cup of orange juice can contain 450 milligrams of potassium and 21 grams of sugar, roughly equivalent to eating 3 oranges, but without any of the fiber that slows gastric emptying and glucose absorption. This creates rapid spikes in both blood sugar and potassium levels that stressed kidneys struggle to manage. Commercial fruit juices often include multiple fruit concentrates, layering potassium sources. A tropical blend might combine orange, pineapple, mango, and passion fruit juices, creating a potassium concentration that can exceed 600 milligrams per cup. Marketing terms like 100% fruit juice or no added sugar create health halos that obscure these realities. The sugar concentration in juice triggers the glycation cascade mentioned earlier, where fructose molecules bind to proteins forming advanced glycation, end products that accumulate in kidney tissues. A study published in Nephrology Dialysis Transplantation in 2023 demonstrated that patients consuming more than 3 servings of fruit juice weekly showed significantly elevated markers of oxidative stress and inflammation in kidney biopsies compared to those who avoided juice entirely. Dried fruits frequently contain added sulfites as preservatives, particularly in varieties like golden raisins and dried apricots. While generally recognized as safe for most people, sulfites can trigger adverse reactions in sensitive individuals and add to the overall chemical burden that kidneys must process. Now, before you start thinking you need to avoid all fruit entirely, there's an important distinction to understand. The problem isn't fruit as a category, it's specific types and how they're prepared. Emerging research suggests certain fruits may actually support kidney function when consumed strategically. Rather than viewing fruit as uniformly dangerous, we need to examine which varieties provide therapeutic compounds without overwhelming mineral loads. The key lies in understanding that kidneys respond to the complete nutritional package. Antioxidants, fiber, mineral content, and sugar concentration all interact to either support or strain filtration capacity. Several fruits have demonstrated remarkable protective effects in clinical studies, offering compounds that reduce inflammation, support cellular repair, and improve blood flow through kidney tissues, all without the potassium burden that makes other fruits problematic. Number 3, apples. Among all fruits available, apples present the most favorable risk-benefit profile for individuals managing kidney disease. With approximately 195 milligrams of potassium in a medium apple, they provide sweetness and nutrition without excessive mineral load. This moderate potassium content allows kidney patients to enjoy fruit without constant calculation or anxiety about pushing their daily limits. What distinguishes apples scientifically is their pectin content, a soluble fiber concentrated primarily in the skin. Pectin functions as a chelating agent in the digestive tract, binding to phosphorus and certain waste products before they can be absorbed into the bloodstream. Research published in the Journal of Renal Nutrition in 2020 examined the effects of pectin supplementation in 180 patients with stage 3 chronic kidney disease. Over 6 months, participants consuming 15 grams of apple pectin daily demonstrated a 12% reduction in serum phosphorus levels compared to controls. This seemingly modest decrease translates to significant clinical benefits, as elevated phosphorus directly contributes to vascular calcification and bone disease in kidney patients. The mechanism works through pectin's gel-forming properties. When pectin reaches the intestines, it creates a viscous matrix that traps phosphorus from food, preventing absorption and facilitating elimination through fecal matter rather than urinary excretion. This effectively reduces the burden on kidneys while still allowing nutritional intake. Apples also contain a diverse array of polyphenolic compounds, including quercetin, catechins, and chlorogenic acid. These antioxidants have demonstrated specific anti-inflammatory effects in kidney tissues. A study from Harvard Medical School published in 2021 followed 1,400 women over 15 years and found that those consuming at least 2 apples weekly had a 20% lower risk of developing chronic kidney disease compared to those who rarely ate apples. The researchers attributed this protective effect partly to quercetin, which modulates inflammatory pathways and reduces oxidative stress in glomerular cells. Laboratory research has shown that quercetin specifically inhibits NF-kappa B, a protein complex that controls inflammatory responses. By dampening this pathway, quercetin helps prevent the progressive scarring and fibrosis that characterizes advancing kidney disease. The compound also supports endothelial function, maintaining the health of tiny blood vessels that supply oxygen and nutrients to nephrons. Perhaps most importantly, for kidney patients, apples have a low glycemic index, meaning they release sugars slowly into the bloodstream. This prevents the glucose spikes that contribute to diabetic kidney disease, the leading cause of chronic kidney disease in developed nations. A medium apple contains approximately 19 grams of carbohydrate, but the fiber content slows digestion and absorption, resulting in a gradual, manageable rise in blood glucose. Studies comparing different fruits show that apples produce significantly lower postprandial glucose and insulin responses than bananas, grapes, or watermelon. For practical application, eating apples with the skin intact maximizes benefits as antioxidant concentrations in the peel exceed flesh content by 2 to 6-fold. Organic varieties reduce pesticide exposure, though thorough washing makes conventional apples acceptable. Apples can be consumed raw, baked without added sugar, or incorporated into oatmeal or salads. The key is avoiding apple juice, which eliminates fiber and concentrates sugars, transforming a kidney-friendly food into a problematic one. Cost effectiveness represents another advantage. Apples remain among the most affordable fruits year-round, and their storage stability allows bulk purchasing without spoilage concerns. This accessibility makes them a sustainable long-term choice for patients who need to maintain dietary modifications indefinitely. Number 2, berries. Blueberries, strawberries, and raspberries represent a class of fruits that deliver exceptional antioxidant concentrations while maintaining remarkably low potassium levels. A half-cup serving of blueberries contains only about 57 milligrams of potassium, strawberries approximately 125 milligrams per cup, and raspberries around 140 milligrams per cup. These values place berries among the safest fruit choices for kidney patients who need to carefully monitor mineral intake. The therapeutic power of berries stems from their anthocyanin content, pigment compounds responsible for deep red, blue, and purple colors. Anthocyanins function as potent antioxidants that specifically target oxidative stress and inflammation, two primary drivers of kidney disease progression. Research from Tufts University, published in the American Journal of Clinical Nutrition in 2019, examined anthocyanin intake in 2,600 adults over 8 years. Results showed that those in the highest quartile of anthocyanin consumption had a 23% lower risk of developing chronic kidney disease compared to those in the lowest quartile. The mechanism involves direct protection of nephrons, the microscopic filtering units where kidney disease ultimately manifests. Each kidney contains approximately 1 million nephrons, and as these structures become damaged through inflammation and oxidative stress, kidney function progressively declines. Anthocyanins penetrate kidney tissues and neutralize reactive oxygen species before they can damage cellular membranes and DNA. They also inhibit inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha, molecules that promote tissue scarring. A study from the University of Michigan demonstrated that patients with chronic kidney disease who consumed 1 cup of blueberries 3 times weekly for 12 weeks showed measurable reductions in inflammatory markers and slight improvements in estimated glomerular filtration rate, a rare finding for a dietary intervention. Berries also support blood sugar control through multiple mechanisms. Their fiber content slows carbohydrate absorption, while specific compounds improve insulin sensitivity. Research published in the British Journal of Nutrition showed that blueberry consumption improved insulin response by approximately 10% in patients with type 2 diabetes. For individuals with diabetic kidney disease, this dual benefit of reduced inflammation and better glucose control addresses 2 major disease drivers simultaneously. Frozen berries retain nearly all their antioxidant content and often cost less than fresh varieties, making them accessible year-round. The freezing process actually ruptures some cell walls, potentially increasing bioavailability of certain compounds. You can add frozen berries directly to smoothies, thaw them for oatmeal or yogurt, or eat them partially frozen as a refreshing snack. Strawberries provide additional vitamin C, approximately 85 milligrams per cup, which supports immune function and acts as another antioxidant layer, protecting kidney tissues. Raspberries offer exceptional fiber content, nearly 8 grams per cup, which aids in blood sugar control and promotes healthy gut bacteria. Emerging research suggests that gut microbiome composition influences kidney health through the gut-kidney axis, where bacterial metabolites can either support or impair kidney function. For practical implementation, aim for a half to 1 cup, serving 3 to 4 times weekly, rotating between berry types to maximize the diversity of protective compounds. Avoid berry juices and dried berries, which concentrate sugars and often include added sweeteners. Fresh or frozen whole berries provide complete nutritional benefits without the drawbacks of processing. Number 1, red and purple grapes. Grapes, particularly dark red and purple varieties, contain resveratrol, a polyphenolic compound that has generated substantial scientific interest for its apparent kidney protective properties. Resveratrol activates sirtuins, a family of proteins that regulate cellular health, DNA repair, and longevity. In kidney tissues, sirtuin activation promotes mitochondrial function, reduces oxidative stress, and enhances the natural repair mechanisms that help damaged nephrons recover. Research from the Mayo Clinic, published in Kidney International in 2022, examined resveratrol's effects in 320 patients with early-stage chronic kidney disease. Participants who consumed foods high in resveratrol, primarily red grapes, showed a slower rate of kidney function decline over 3 years compared to controls. The estimated glomerular filtration rate in the resveratrol group decreased by an average of 1.8 milliliters per minute per year, compared to 3.2 in the control group. This difference might seem small, but over time, it translates to years of preserved kidney function and delayed progression to dialysis. The mechanism involves resveratrol's ability to reduce inflammation and prevent fibrosis, the scarring process that gradually destroys kidney tissue. Laboratory studies show that resveratrol inhibits transforming growth factor beta, a key mediator of fibrosis, and reduces collagen deposition in kidney tissues. It also improves endothelial function in the small blood vessels that supply nephrons, ensuring adequate oxygen and nutrient delivery to support cellular metabolism and repair. Grapes provide additional benefits through their high water content, approximately 82% by weight. This natural hydration supports kidney function by helping maintain adequate blood flow through filtering units without requiring excessive fluid intake that could be problematic for patients with advanced disease. The natural sugars in grapes are balanced by fiber and other compounds that moderate absorption, though portion control remains important. A serving of 15 to 20 grapes 2 to 3 times weekly provides therapeutic doses of resveratrol without excessive sugar intake. This translates to approximately 80-100 grams per serving. Consuming grapes with the skins intact is critical, as resveratrol concentrates primarily in the skin. The darker the grape, the higher the resveratrol content, with Concord, black, and deep red varieties offering the most significant concentrations. Research comparing grape varieties found that dark purple grapes contain up to 3 times more resveratrol than green, seedless varieties. Grapes also contain proanthocyanidins, another class of antioxidants that support vascular health. These compounds help maintain the flexibility and integrity of blood vessel walls, reducing the risk of hypertension-related kidney damage. A study in hypertension research demonstrated that regular grape consumption modestly lowered blood pressure in patients with prehypertension, an effect attributed partly to these vascular benefits. For practical use, fresh grapes offer maximum benefits. While red wine contains resveratrol and has been marketed for cardiovascular health, alcohol itself is nephrotoxic and should be avoided by kidney patients. The alcohol content negates any potential benefits from resveratrol. Similarly, grape juice often contains added sugars and lacks the fiber and complete phytochemical profile of whole grapes. The cost-effectiveness of grapes varies seasonally, but buying in season and freezing extra supplies makes them accessible. Frozen grapes also serve as a satisfying frozen treat that can replace ice cream or other high-phosphorus desserts. Understanding which fruits support kidney health versus which accelerate damage is crucial, but implementation determines outcomes. Theory without application provides no benefit. The challenge for most patients isn't knowing what to eat. It's creating sustainable habits that integrate protective foods while eliminating harmful ones. Research consistently shows that dietary adherence predicts health outcomes more strongly than the theoretical perfection of any eating plan. A moderately beneficial diet, followed consistently, outperforms an optimal diet abandoned after 3 weeks. To maximize the kidney protective effects of beneficial fruits while maintaining safety, consider a structured weekly rotation. This approach ensures varied nutrient intake, prevents monotony, and maintains potassium levels within safe ranges. Monday and Thursday, consume 1 medium apple, preferably with skin, either as a snack or incorporated into meals. Tuesday and Friday, have a 1/2 to 1 cup serving of berries, rotating between blueberries, strawberries, and raspberries to maximize antioxidant diversity. Wednesday, enjoy 15 to 20 red or purple grapes, ensuring you eat the skins. This pattern provides consistent antioxidant and anti-inflammatory support throughout the week, while keeping potassium intake well below problematic thresholds. The rotation prevents accumulation of any single mineral while ensuring regular delivery of protective compounds like pectin, anthocyanins, and resveratrol. For patients who enjoy smoothies, blend berries with low potassium liquids like almond milk or rice milk, avoiding banana, orange juice, or coconut water. Add ice, a small amount of honey if needed for sweetness, and consider protein powder formulated for kidney patients to create a satisfying meal replacement. Preparation timing can enhance benefits. The choices you make around fruit consumption might seem minor in isolation, but their cumulative effect over months and years fundamentally shapes kidney disease trajectory. Every time you reach for an apple instead of a banana, berries instead of dried fruit, or grapes instead of orange juice, you're making a decision that either protects or strains your kidney function. These aren't dramatic interventions that produce overnight transformations. They're consistent, evidence-based modifications that gradually shift your biochemistry in a more favorable direction. Research tracking long-term outcomes in chronic kidney disease consistently demonstrates that patients who maintain dietary modifications experience slower disease progression, fewer complications, and better quality of life compared to those who don't adjust their eating habits. Your kidneys have been filtering your blood continuously since before you were born. They've removed countless toxins, maintained your electrolyte balance, and supported your body through illness, stress, and daily life. Now they need support in return. That support doesn't require expensive supplements, extreme dietary restrictions, or complicated protocols. It requires making informed choices about the foods you eat, prioritizing those that reduce inflammation and mineral burden while avoiding those that accelerate damage. The evidence base is clear. Strategic fruit selection makes a measurable difference in kidney disease progression. By choosing apples, berries, and grapes while eliminating bananas, citrus, melons, and processed fruit products, you create conditions that allow your remaining kidney function to be preserved longer. Combined with appropriate medical care, blood pressure control, and blood sugar management if diabetic, these dietary modifications represent a comprehensive approach to protecting your kidney health. The question isn't whether these changes will help. The evidence confirms they do. The question is whether you'll implement them consistently enough to experience the benefits. Your kidneys are still fighting for you, processing every drop of blood, working within their diminished capacity to keep you alive. What you eat in the coming days, weeks, and months will determine how much longer they can continue that fight and how much function you preserve for the future you want to live.